changing the curvature of your spine, correcting the curvature of your spine so that it is more like a shock absorbing spring and producing less pressure on your intervertebral discs or the cushions between the bones in your spine and the nerves that lie between the bones in your spine. Improve disability. Can it improve pain? Can it improve intervertebral movement or the movement between bones in your spine? Can it improve reflex parameters? Well, the short answer is yes, absolutely. And in a recent randomized control trial involving 64 people with lumbosacral radiculopathy, meaning they had an impingement of their S1 nerve root. That's the first nerve that comes off of the sacrum down here, and it travels down the back of your leg. And so commonly people will call this sciatica. Now the sciatic nerve is anywhere from L4 to S2. It's a lot of different nerves that originate in the lower spine, lumbosacral spine. And so you get similar like symptoms. You get some pain and numbness and tingling and sometimes muscle weakness that travels down the back of your leg. This is the distribution, in this case, of the S1 nerve and goes to the bottom of the foot. And anyway, so these people had that. And the reason they had it was because they had a unilateral, meaning one side, disc herniation at L5. And that disc was pressing on the S1 nerve root. So what that looks like is if this is your disc, these outer fibers are called the annulus fibrosus. And inside we have this jelly called the nucleus pulposus. And so if this is one bone of the spine and this is another, and this jelly-filled donut, if you will, is in the middle, if we tear the outer fibers here, whether it be from trauma or degeneration over time or anything of that nature, then the jelly can partially leak out. And then the disc presses on the nerve, right? If it presses on the nerve, it's going to affect everywhere that that nerve goes, produce pain, numbness, and tingling, sometimes even weakness. And so these people not only had the S1 radiculopathy, but they also had a decreased lumbar lordosis, meaning they had a reduced curve in their lumbar spine. All of them had a 39-degree curve or less. And as a frame of reference, a normal curve is 40 to 60 degrees in the lumbar spine. So that's a big difference. Now they had them do interferential treatment, which is basically electric stim, heat therapy, and lumbar traction, or they had them do interferential and heat alone. Now after just 10 weeks, the group that did the lumbar traction alongside the interferential and heat therapy had significantly greater improvements in levels of pain, disability, intervertebral movement, and reflex parameters. So affecting the spine curvature can absolutely improve your quality of life. That is undoubtable. And you can go on a traction machine. So what does lumbar extension traction look like? Well, you could do it standing, you could do it seated, you could even do it laying down. And what they do is they want your curve more like this in the low back, right? So theirs was more like this. So they wanted to make it more curved like that, so there's less pressure on the nerves and the discs, right? And so they'll pull you this way, and they'll pull you like that, or they'll pull you like that and like that, just to push this forward, right? Juk the belly, a nice full belly, full good dinner. But it's really amazing, and when you think about it, it makes total sense. If you had a rigid, straight spine, put your finger up like this right now and press on your finger. These joints here are getting crushed, aren't they? If these joints are your discs between these bones, which are your phalanges, right? Your interphalangeal joints here are getting crushed. Now bend your finger and push. It's a shock-absorbing spring. And so that's why the spine has that S curvature. It absorbs shock, and it reduces pressure on the discs over time, making it less likely for them to become thin and degenerate, and reduces pressure on the nerves. So that not only can be done with the lumbar extension traction, but also with postural exercises, like we've shown here at Wem Wellness. So keep good posture and consider getting lumbar extension traction, especially if you have symptoms in your low back or anything going down your legs, and get evaluated by a doctor first and foremost. They'll do a whole exam and find out exactly what's going on. We're not going to diagnose anybody over the video, but that's what we got for you guys today. So let's say what's up to the people. We're going to get out of here. Thanks. You're great. Very beautiful camera woman. Gino, what's up, man? How you doing? I'm going to see you soon. Dugan, what's happening? Thanks, guys, for coming on. Amarasil, Lalo Jim, Guillermo, Shushite, and Berlin Bad and Starkey Brian. You guys, first one on today. This one's for you, my fine feathered friends. I hope you had a great day, and I hope you have great posture, especially in your low back, regarding today's discussion, but it's extremely important for your neck, mid-back, really the whole spine. A lot would argue the neck's even the most important, but we're not going to grade any more important than the other. Just keep great posture, keep a healthy lifestyle, and have a great life, and be happy and healthy. So that's what we got for you guys. As for now, that's all we got for you folks. We'll see you tomorrow, baby. Not sure where, not sure when, but we'll see you then. Have a great night. Thanks.